got all of the best military medical minds in a whole bunch of NATO countries at the moment. We've all got the same problem sets, which is how we address capacity and scale in a way that we haven't had to do as a bunch of nations for an awfully long time. So the program, which I think has got that civilian military integration running through it, but also how we get after capacity. But it's also the discussions around the edges with all the people that we get to meet at these conferences, because everyone has a slightly different perspective and different bunch of ideas. So it's like cross-fertilisation of ideas, I think.
For me, this is the premium medical military conference in the UK. It's a very prestigious event, so it's better than anything else for us in the military.
What is really interesting here, you have the very well-balanced blending of industry and also the military medical services. So there are not many other conferences that you can actually meet industry and discuss your problems in the medical healthcare.
We talk about interoperability and alliances all the time, and we're getting to meet other practitioners, other specialties, other countries, and discuss the way we do our business. So that definitely moves us along.
The key for this conference for us is really talking to the NATO and their allied nations, the medical community there, because the majority of those countries and nations are here, and this is where we seek the direct contact. Sometimes we have long-term partnerships, yes, sometimes friendships, to actually, keep on going and learning and listening.
I think in terms of the industry partners who've been here, the sponsors, being able to see that there's a number of people across the industry who are really listening to the problems that military might have and really focusing what they're doing on innovating in across the breadth of things we're looking at.
This is fairly unique due to the seniority of the military medical personnel that attend. So we've had some really, really impactful conversations, great opportunity to get key decision makers that have decision-making powers all under one roof and are engaging with industry partners such as ourselves.
We're encountering customers that we've not been able to previously make contact with. This is a target-rich environment for us. Having the key decision makers and those influencers come in and get hands-on experience with the equipment that the end user is ultimately going to be requesting is foundational for us.
Well, when we get to spend time with our clients, we hear about their needs, and there is no better way to do that when the clients, industry and everybody involved comes together.
Bringing a big community together, whether that's the Defence Medical Services or our international partners and allies, sharing our problem sets and coming up with a way forward in terms of trying to identify the solutions with both my military colleagues and the commercial sector.
National, international, civilian, military, third sector, they're all here, and the companies, because if we're going to build that integrated operational patient care pathway, we need all those people involved. And they're all here in one room. And that's what makes it really great, that everyone's here and we get the opportunity not just to hear from each of the speakers, but then to follow it up and have conversations over coffee, etc. So it's having everyone all in one room over a couple of days.